country. KITV4's Aaron Coogan joins us live from Waikiki from the Honolulu Fire Department. Aaron, good morning.
Yeah, hey, good morning, Julia. Well, in the last half hour, we introduced you to 11-year veteran Monahel with the City and County of Honolulu, serving as a paramedic. We talked about the ins and outs of the daily routine, but now we're going to take you inside of an ambulance. There's so much stuff that I'm unfamiliar with, and you got to be really familiar because it really comes down to the seconds to save a person's life, bring them to the hospital.
Absolutely. So some of the equipment that we have here, we have our LifeVac 15. This is a great machine. We're allowed to defibrillate and cardiovert patients who are in cardiac arrest or in a lethal rhythm. So we try to get the heart out of that rhythm. We also have a way to look at the different angles of the heart with these type of stickers. It's called a 12 lead EKG. So this is definitely one of my favorite tools. We also have a drug bag, technically medication bag, and this hosts most of our medications to try and help with the ailments that people call 911 for. Also, we're able to deliver babies, so we do have like the packs to kind of sterilize to help kind of with the mom and the baby when that does arise if they can't make it to the hospital. Also, a great life-saving tool that we now have is the Lucas device, and this allows to apply to the patient during cardiac arrest and do compressions for us, so we're able to focus on other things like the medication, the IV access, and the airway. The bag that you're holding right now is called a CPAP machine, and this is continuous positive pressure into the patient. This is for respiratory calls when they're in respiratory failure just prior to impending respiratory arrest. This is a great tool for us, and it kind of helps bring the patient back to their normal respiratory drive as quick as possible without having to intubate them, but we will intubate them if needed. Another tool we do have is the glide scope, and that is part of our intubation. And we also have radios to help communicate with the doctor to notify the hospitals that we're coming in. That way they can get their teams activated and make sure that patient care is priority.
You know, when you're talking your 12-hour schedule, how many people are in the ambulance at one time on a call, and what does that look like communicating between you guys?
It could be one, it could be up to an MCI, which is mass casualty. If that's the case, I do use resources as fire, HPD. We dispatch other ambulances within the area. Also, our district chief will come out and kind of help us. As far as within one ambulance, obviously we can set a few people on the bench, typically just one on the gurney, but we try to assess people as much as possible, as quick as possible, and kind of, make sure that everyone's getting the appropriate care.
Well, a little taste inside of the jobs that keep you and your family safe. Thank you so much for everything that you do. National First Responders Day tomorrow, so go out, give them a little pat on the back. For now, reporting live, Aaron Coogan, KITV4 at the news. Leah?